we would really like to invite him to speak. He could have had any of his ministers come, but he chose to come himself, which really tells us that this meeting and this topic is dear to his heart. It's not just a passing interest. Thank you. Minister.
Thank you very much, Professor. Professor Vassiani, my colleague minister, and member of parliament. All of our distinguished guests here, and so many, I can't single out everybody, but I have to also welcome those who are from overseas and the university fraternity. And it's good to be here with you this morning, and the topic is rather intriguing and necessary, I think. And I want to assure you, however, that as Minister of Finance, I will not be announcing any fiscal measures this morning. But certainly, we look forward to the deliberations and receiving the report of your deliberations so that it can become an important part of the discussion going forward. It is a timely and important topic, as I believe we can all agree that there is increasing global concern regarding the prevalence of lifestyle diseases such as obesity, stemming from the excessive consumption of sugar. The same is true for other lifestyle non-communicable diseases such as heart attacks, strokes, diabetes. Regionally, these concerns are supported by a number of studies on the dangers of excessive sugar intake and unhealthy eating habits of our Caribbean people. And I have to say, I'm pleased to join with my colleague minister, Dr. Tufton, and the knowledgeable panel assembled here to discuss this issue and find ways in which we can join together to address this concern. I myself, I have to confess, 2 years ago, I went to visit my cardiologist, and as usual, I had to go on the scale. And I went on the scale, and I was more surprised than my cardiologist because it clocked in at 265 pounds. And I made a decision that was unacceptable, as my 8-year-old daughter would say. And so I immediately made a conscious plan to cut out sugar and to reduce my intake of food. And I'm pleased to tell you that I visited my cardiologist again this year and went back on the same scale, clocked in at 234 pounds. So 30 pounds gone, right? And that's not my target. My next target is 220. And my next target is your weight, Chris. But ladies and gentlemen, the impact of non-communicable diseases can be seen not only in the illness of individuals, but is negatively impacting our entire healthcare services. Because naturally the cost of healthcare is impacted. There's an increasing concern, there's increasingly concerning the trend of obesity among our population locally. Recent national surveys have also documented an increase in the 4 major behavioral risk factors and non-communication, NCDs, let's call it that for now, such as diabetes, hypertension, and obesity among adults. The National Strategic and Action Plan for the Prevention and Control of Non-Communicable Diseases sets an ambitious target of reducing obesity prevalence in adolescents and adults over 18 years by 5% in a few years. This will, however, require a joint government approach with all relevant ministries coordinating to tackle this burgeoning problem. The Ministry of Finance, as a key driver of economic growth, is quite cognizant of the far-reaching impact of NCDs on national productivity and development, and therefore stands ready to play its part in helping to find workable ways to resolve the problems. Productivity. Jamaica has been in persistent productivity declines over the past several decades. Not very many people know that in 1964, Lee Kuan Yew of Singapore came to Jamaica because he was impressed at our economic growth rate, and he was impressed by the productivity growth among Jamaicans. And he went back, established the Singapore Development Bank on the model of the Jamaica Development Bank. Well, fast forward to today. Their productivity is among the highest in the world. Their per capita income is now United States $55,000. Ours is $5,500, 10% of theirs. And our productivity is heading in the wrong direction. And it is important to note that our diet and our overconsumption of sugar and all of the negative effects are a part of that negative productivity profile. It is interesting to note that 4 out of 5 Jamaicans die from these non-communicable diseases annually, with 30% of these deaths occurring in persons between the ages of 30 and 70 years old. Naturally, this correlates with our national productivity output and growth as a country, as these individuals could have contributed even more to their communities, families, and places of employment had it not been for their demise. This is supported by a study conducted by the Pan American Health Organization, the Ministry of Health, the World Health Organization, the United Nations Development Program, and the RTI International on NCDs in Jamaica. In addition, the government spends more than $170 million each year on these chronic diseases, which diminishes the ability of the Ministry of Health to finance infrastructure development within the health sector and other vital aspects of healthcare and prevention. I'm therefore encouraged by the convening of this symposium and the slate of presenters gathered here, who will be addressing ways in which we can rebalance, redirect consumers to more healthy options, particularly sugar-sweetened beverages. We must join together to act more decisively to curtail the negative impact of sugar-sweetened beverages on our population, especially our young children. And I want to make the point that while your promotion seems to emphasize fiscal measures, I think it goes far and beyond just fiscal measures. It goes to a message to our children. I encourage my 8-year-old, drink water. And we must all consume much more water than we consume normally. There's an ad on the radio, I think put out by Water, that suggests that women should have at least 4 bottles of water per day and men at least 5. And I suggest that that is a minimum that you should be consuming. I want to encourage everybody, drink water, water, water. And I want to say also that it's not just fiscal measures alone. It's habits, lifestyle, and it is, and I'll come to that, but it has to be a willingness of the producers of beverage to lead the way, set the example. Don't wait for the tax acts to force you to do it. They need to start reducing the sugar content even before fiscal measures are contemplated. So, ladies and gentlemen, a cursory look at other jurisdictions will show that across the region, several countries have implemented measures to lessen the impact of sugar-sweetened beverages on school-age children and ultimately the social and economic fabric of their country. Last November, St. Lucia announced plans to push for the discontinuation of the sale of soft drinks on school compounds. The Ministry of Health and Wellness in St. Lucia identified the highly sweetened soft drink, or sodas, as having disastrous effects on health and linked the frequent consumption of soda to diabetes, heart disease, obesity, and other illnesses. Barbados also imposed a ban on sugar-sweetened drinks in schools against the backdrop of rising levels of obesity in their school-age population. Over in Trinidad, their Minister of Health implemented a ban on all sugary drinks, including soft drinks, in schools across the country. They also launched an awareness campaign as part of an NCD program they implemented last year. Dominica has also imposed a tax on sugar-sweetened beverage. These Caribbean countries join countless others, such as Denmark, Finland, France, Hungary, Ireland, Mauritius, Norway, and South Africa, which have successfully taken steps to reduce the consumption of sugar-sweetened beverages by their populations. Not to mention New York, that was recently done in the United States as well. So, ladies and gentlemen, Jamaica is also making strides in this regard. The Ministry of Health has been running campaigns aimed at getting Jamaicans to increase their physical activity and reduce their salt and sugar intake. The most recent campaign, we have to commend our Minister of Health, Jamaica Moves, has seen much traction since its launch in April last year. These efforts of the ministry and others to get Jamaicans to improve their food choices and become more active are important initiatives, and again, the Ministry of Finance reiterates its support for this initiative. You know, Minister Tufton has been going around the country dancing on platforms, and he made the error of inviting me to join him in Manchester. And, well, shall we say the rest is history. He hasn't invited me to anyone else. We have also banned the sale, and the Minister of Education has announced that the issue of sweetened juices in schools by the state-run Nutrition Products Limited, that's going to be banned. Senator Reid has also announced the introduction of a school nutrition policy for the upcoming school year, which will help to reduce consumption of sugar-sweetened beverages among our schools. So, ladies and gentlemen, our Prime Minister, Most Honorable Andrew Holness, has also noted his consideration of a ban on these types of beverages. These interventions indicate that we are mindful of the need to address this issue and have started to do so, but I readily acknowledge that we have to take a more aggressive stance in relation to this matter, and that is where your deliberations and your conclusions today will be considered very seriously by the government. Our steps toward curtailing the problem have been bolstered by the recommendations of agencies such as the World Health Organization, which has urged member states to develop guidelines to reduce the content of sugar in food and non-alcoholic beverages. The organization has suggested member states to consider the implementation of taxes and subsidies that will create incentives to encourage behavior associated with improved health outcomes, improve the affordability and encourage consumption of healthier food products, and discourage the consumption of less healthy options. One key target for this through the World Health Organization recommended action is sugar-sweetened beverages. As a country, we cannot and have no intention of ignoring these recommendations. One of the steps we want to take toward addressing the matter of sugar-sweetened beverage is to urge the manufacturers of these beverages to take a serious look at sugar content of the products. Our manufacturers need to pause and take a very serious, urgent look at the sugar content of their products. We are calling on these manufacturers to reduce the sugar content of their products, especially those marketed to children. As manufacturers, you are the ones armed with the research and development to support the production of the beverages you sell. By that token, you are also armed with information on the impact of your products on your consumers. We want you to become more responsible in what you include in these products. I'm saying to manufacturers today, you can either respond voluntarily, or we as a government can respond to the needs of the country through policy, appropriate policy prescriptions. Fair warning, therefore, is being given today. Start the process. Don't wait for the tax acts to come. Jamaica has a population of less than 3 million people. Mike Henry might put it over 3 million, but yet we consume, hear this, we consume over 2 billion 8-ounce servings of sugary drinks per year. A population of less than 3 million people, and we consume over 2 billion 8-ounce servings of sugary, highly sugary drinks per year. This is staggering information. What is also alarming is that Jamaica's economy is projected to lose over 77 billion Jamaican dollars over the next 15 years due to direct costs for treatment and indirect costs arising from lost productivity due to cardiovascular disease and diabetes complications alone. $77 billion. Ladies and gentlemen, it is incumbent on consumers to arm themselves with information that will see them making healthier choices, because at the end of the day, it is your health that is impacted. Government cannot legislate away your freedom of choice. As consumers, you must act in your own interest. The Jamaica Moves campaign seeks to educate consumers on better health choices. I am urging all Jamaicans to join the move and arm yourself with information that can help to guide better dietary choices and get fit and healthy. And to manufacturers, I repeat, I urge your cooperation in reducing the sugar content of your products, or we will look to other means of getting you to comply. I have, Chris, I know you're doing your walking, and I've gotten my treadmill running again. And I've also acquired a stationary what do you call that? Bicycle. So I'm on the move. Ladies and gentlemen, thank you so much. We look forward to the outcome.